Howdy everyone, Matt here, coming at you with another orthopedic special test. No, Mateo is not here today, he took the day off. But we're going to talk about a special test for the elbow. It is Polk's test. Now this test was not developed by James K. Polk, the 11th President of the United States. However, it was developed by Dr. Bradley Pokinghorn, a chiropractor in California, in a paper in 2002. And what he was wanting to do with this test is have a very quick and easy way to test somebody with elbow pain to differentiate between a lateral epicondylitis and a medial epicondylitis. So to perform this test, you don't need much equipment at all. You just need something that weighs about 5 pounds or 2.5 kilograms. So in the paper, he utilizes a book. Now I will say some of the books, I started weighing some books that looked like the things in the pictures, and sometimes they didn't weigh enough. They were around like 2 pounds. So if you not too sure about the book there, you can use the weight. So what you want to do is the person has their palm down, elbow bent, they grasp the weight, and then they come up. And if this produces pain, it is a lateral epicondylitis. If it doesn't, you test the second part where they have their palm up and they come up the same way. And if this produces pain, it's a medial epicondylitis. Now I will say the hand position is different with the book versus the weight. So if you see here, as they come up, they're in like this position, and then the opposite as they're coming up with the book out that way. So that could be something. So he based this test off of some of the tests that we already do for medial and lateral epicondylitis. So Cozen's test, where we resist the wrist extension, and then the medial epicondylitis test stress the flexors of the wrist. So he said, well, let's come up with this quick and easy way to do it. I will say there are some limitations to this test because there is only one paper on it. There's no reliability studies, no validity studies, no specificity, so there's none of that out there. Also, I would say this test as well, is this test more likely to be beneficial if somebody's in a more irritable state? So maybe somebody who is early on and in that inflamed state, that they're going to have pain with one versus the other, versus someone who maybe is in a later state there. So that's it. So that's the Polk's test. That's Polk's test for elbow pain. So let me know, what do you think about it? Do you use this test? Have you heard of it? What do you think about it? Do you think more research needs to be done into it? So with that being said, let me know that in the comments. And like always, take care of yourself. Take care of your patients. I'll see you next time.